This is the room we'll be in today. You can have a seat in this chair. Hello, I'm Dr. Hale. I'm the doctor who's scheduled to meet with you today. What would you prefer for me to call you?
You can call me Alma.
It's nice to meet you, Alma.
Nice to meet you too.
So I'd just like to introduce myself. I'm a medical doctor. I usually treat patients at a clinic at the local hospital. Did your lawyer explain the purpose of today's visit to you?
She did, but I can't remember the details.
That's okay. So the purpose of today's visit is to discuss some of the things that happened to you in El Salvador and also take a look at any scars or injuries that you may have. Your lawyer already gave me a copy of your declaration to review. We'll be discussing some of what you wrote in your declaration, and I'll also be asking you some additional questions. I know you already met with Dr. Shaded for a mental health evaluation, so today we're going to be focusing on your physical health. I won't be treating you for any injuries today. Instead, I'll be doing an assessment. And after I do that, I'll write a report and I'll give that to your lawyer, and they may use it in your immigration case. Now, I just want to let you know that I'm a volunteer and I don't work for the government. Does that help explain the purpose of today's visit?
Yes, that makes sense.
As part of my assessment, I'm going to be asking you a lot of questions, and it's normal to not know or not remember some of the answers to those questions. If I ask you something and you're not sure of the answer, we can always skip the question and come back to it, or feel free to just tell me that you don't know.
Okay.
Now, I understand Spanish is your first language, but you are fluent in English and you're comfortable in having this conversation in English. Is that right?
Yes, English is fine.
Okay. If I ever say something that you don't understand, please just let me know. We can always reschedule with a Spanish interpreter at a later time.
Okay.
Okay. I want to let you know that everything you tell me today is partially confidential. The only person that I'll be sharing this information with is your lawyer, and they may use my report in your immigration case.
Okay.
And finally, I want to make sure that you feel comfortable and safe in this space. I imagine that discussing some of your past might be difficult. If you ever need to take a break or you just want to stop, please just let me know.
Okay.
Did they show you where the bathroom was on the way in?
Yes, they showed me.
Great. And there's water and tissues here if you need them.
Thank you.
Do you have any questions for me before we get started?
No.
Okay. Let's start with having you tell me your full name and birthday.
Alma Flores, May 30th, 2002.
And where were you born?
In Soyapango, El Salvador.
And where do you live now?
I live with my tia in San Diego.
How do you like it there?
I like it. There are parts of El Salvador that I miss. There was a lot of violence where I lived, but we had good neighbors. We looked out for each other. I don't have those kinds of friends here, but my tia's very good to me. I'm very grateful for her. I do feel safe here, even if it feels lonely sometimes.
I'm glad to hear you feel safe here, Alma. Now I want to talk about what happened in El Salvador that made you leave. You described in your declaration that you and your family were threatened by gangs. Can you tell me some more about that?
There was a lot of gang activity where I grew up. They would always come after people for money, and kidnapping and killing people was awful. People in my neighborhood would go missing and then later turn up dead.
That does sound awful. Did the gangs threaten you or your family?
They came after my dad when he couldn't pay them the money they wanted. They tried to get me and my sister to join them, but my dad wouldn't allow that. We would have to take back roads to and from work just to avoid them when they came to our house looking for us. We knew that made them angry, but my dad told us not to worry, that we would figure something out.
Do you remember roughly when these threats first started?
Sometime in early 2019, I think, but they didn't do anything until that October.
Could you tell me more about what happened then?
One night, I was walking home from work with my friend Elsa. We heard men's voices yelling at us to stop. It was the same men that had been coming to our house. One of them, Malo, was there. I was so scared. I looked at Elsa and she started crying and just kept saying, "I'm sorry." And I realized that she had told them where we were. They let her go and they came at me. I tried to give them all the money I had, but they just laughed. They backed me up into an alley and kept saying things like, "We're going to have fun with you," or "You can thank your dad for this." I threatened that I was going to scream, but they told me if I did, they would shoot me in the mouth. I tried to do it anyway, but one of them hit me on the head and I don't remember anything after that.
That sounds very upsetting. Are you okay to continue?
Yes.
Can you tell me what happened next?
I woke up in the alley. I was alone and completely naked. I had to run home like that with no clothes. When I got home, I looked in the mirror and saw bruises all over my body. I was bleeding from my head, and I still have a bump from where they attacked me.
I'm so sorry that happened to you, Alma. Could you tell me more about how you felt after the attack?
I felt awful. My head was throbbing and I was just so dizzy. I felt like I was going to throw up and everything hurt. I felt like I couldn't do anything for days. The headaches were so bad, I just wanted to lay in bed. I was so tired, but when I tried to sleep, I just couldn't.
How long did that go on for?
I can't really remember. It's a blur. The headaches were pretty bad for a week or two after.
Could you describe the headaches to me?
They were throbbing on the right side. And whenever they started, I felt nauseous. I would just lay in bed until they went away. I still get them every now and then, but not as much.
Did you have any difficulty with your vision after the attack?
No, just lights bothered me when I would get the headaches.
Did you have any trouble with concentration after the attack?
Yes. I would try to read a book just to pass time, and I couldn't focus on the pages. So I would just lay in bed and not do anything.
Is there anything else you remember about the attack or how you felt afterwards?
No. I still can't remember anything after they hit me in the head. I just remember waking up in the street.
Do you have any idea how long you were unconscious for?
I'm not sure exactly. I remember I left work around 9, and when I got home after they attacked me, it was a little after 10, so it must have been less than an hour.
Thank you for your patience with all these questions. Did you have any other pain or any other symptoms after the attack?
Afterwards, I had bleeding from my vagina and pain there that was so bad I couldn't even sit or walk.
That must have been very scary. Are you still experiencing any of those symptoms?
No, it all went away after a few days. I was worried that I could have been pregnant, but I got my period a few days later.
Did you ever see a medical provider after the attack?
No, I just stayed home. I was too scared and embarrassed.
I'm so sorry that you had to go through that by yourself, Alma. Since that time, have you ever been tested for sexually transmitted infections like HIV?
No.
If you'd like, I can give your lawyer some information about a local clinic that can do that testing for free.
Okay, that would be helpful. Thank you.
Were there any other symptoms that you experienced after the attack?
No, not that I can remember.
And any other times when you've been threatened or attacked?
No, just that one time. I came to the US pretty soon after that.
Did you ever report what happened to the police?
No. My dad was worried that if we went to the police, that gangs would retaliate. That has happened to people he knew.
Would you have felt safer if you moved to a different neighborhood or area in El Salvador?
No. Once they were after you, they can find you anywhere.
And how about since you moved to the US? Has anyone here ever hurt you in any way?
No.
And Alma, I know this is difficult to think about, but if you were forced to return to El Salvador, can you tell me what that might be like for you?
I would be terrified. I know that they would find me. They would hurt me again, or they will kill me.
I'm so sorry that you have to worry about that. Thank you for sharing all that information with me. I want to ask you a little bit about your health now. How have you been feeling recently?
I still get the headaches every now and then, but not nearly as much.
Did you have headaches prior to the attack?
No, never.
And how is your concentration now?
It's much better, but it's not like how it used to be before I was attacked.
Can you tell me how your concentration is different now?
When I was in school, I did really well. I liked solving problems. But now, whenever I try to think about something hard, it just makes my mind hurt. Like the other day, I was just trying to add up the cost of a few groceries, and it was just too much. The simple math felt overwhelming.
How is your memory now?
I don't think my memory has been the same after the attack. I forget things a lot. I forget what people just told me. My tia always jokes and calls me vieja because I can't remember where I put my keys or my phone. It's just, I'm so forgetful.
Other than the attack, are there any other times when you've injured your head or your neck or lost consciousness?
No, not that I know of.
Have you ever had a seizure?
No.
Other than your headaches and problems with memory and concentration that you mentioned, do you have any other medical concerns you wanted to talk about?
When I met with Dr. Shaded, she recommended I get help for depression and PTSD. I started going to therapy, and it's been really helpful. My counselor is really wonderful.
I'm glad to hear that. Now, I know you spoke with Dr. Shaded about how this experience impacted you emotionally, but I do want to ask you again, have there ever been times in your life where things have gotten so difficult that you've thought about hurting yourself or maybe even ending your life?
No, especially after the attack. There were times where I just wanted to fall asleep and just not wake up. But I'm Catholic and I could never do something like that. And I love my family too much to do that.
Okay. Other than what we've discussed, do you have any other medical conditions or concerns you'd like to talk about?
No, I don't think so.
Have you ever spent the night in a hospital?
Not that I can remember.
Have you ever had a surgery?
No,
Are you taking any medications?
just the aspirin for the headaches. My counselor mentioned that there are some medications to help with depression, but I haven't looked into that yet.
I'm glad they brought that up with you. That's another thing the local clinic I mentioned might be able to help you with. I'll be sure to get that information to your lawyer.
Okay.
And how about your parents? Do they have any medical conditions?
No, they're both healthy.
Finally, I have some specific questions for you about how your body is feeling. Do you have any trouble with your stomach, like pain or nausea?
No,
Any pain or difficulty urinating?
no,
How are your bowel movements?
they're normal.
Any pain in your muscles or joints?
No,
And do you have any other health concerns or anything else you'd like to share with me?
no.
I'd like to talk about the bump on your head now. Can you remember what you were hit in the head with?
I think it was the butt of a gun. I closed my eyes before they hit me, so I don't remember what happened.
Okay. Would it be all right if I examine the bump now?
Yes, that's okay.
Okay. I'm going to need to touch your head a little bit, okay? Does it hurt where I'm pressing right there?
It did right after the attack, but it doesn't hurt anymore.
Okay. If you're comfortable with it, I'd like to include photos of your injuries with the report that I send to your lawyer. I'll show you all of the photos I take so you can decide which ones are okay to use. How do you feel about that, Alma?
That's okay.
Okay. In a minute, we're going to take a picture of the bump on your head, and I'm going to place this paper ruler next to it so that we can show the size in the photo. Is that all right with you?
Okay.
Okay. Okay. Will you hold that right there next to your skin? Perfect. Is it okay to use that photo?
Yes.
Okay, great. I'll take that. Now, I'd like to do a series of tests to check your memory and how your brain and the nerves in your body are working. Is that okay with you?
Yes, that's fine.
Thank you for your patience with those tests, Alma. Everything was normal. That doesn't necessarily mean the head injury you experienced hasn't impacted your memory or concentration, but rather that it hasn't caused you to have abnormal results on these tests. That may be because the impact to your brain wasn't that severe, or it may be because your brain has been healing since then. Does that make sense?
Yes, it It does. I'm glad to hear that.
Okay, so we've talked about the injury to your head. Do you have any other scars or injuries related to the attack?
Actually, I forgot to mention I've had pain in this shoulder ever since then.
Can you tell me more about that?
It started after the attack. I think I might have been dragged by my arm or something because when I woke up there was a big scrape there. And there was a lot of dirt and little pebbles in it. When I got home, my sister helped me wash it off, and it's healed since then, but my shoulder hasn't been the same. It's not bad most days, but it's only really bad when I lift my arm over my head.
Can you show me where it hurts?
It's right here.
Do you have any weakness in your arm?
No,
What about any change of feeling or sensation in your arm or hand?
no.
I'd like to examine your shoulder more closely. Would you be comfortable changing into a gown? I'll step out of the room while you do so, and you can leave your bra and underwear on.
Okay.
Okay. Here's a gown. You can put it on like this, and there's a snap in the back to keep it closed. Okay. And I'll step out while you do that. Is it okay if I come back in, Alma?
Yes, I'm ready.
Okay. I'd like to take a look at your shoulder scar now. Could you show it to me?
Yes, it's right here.
Okay, yes, I can see that. Would it be all right with you if I open up the sleeve of your gown so I can take a closer look?
Okay.
Okay, thank you. So we're just going to unsnap this. And I'm going to pull this back. And I'm going to touch your skin now. Would it be all right with you if I take a picture of this scar with the ruler as well?
Okay.
Okay. So we're going to hold the ruler up to your shoulder. And is it okay to use that picture?
Yes.
Great. And let me close that sleeve up for you. So now I'd like to do some shoulder movement tests to see if you have any injury to the shoulder joint and muscles. Would that be all right with you?
Okay.
Okay, great. Based on your shoulder exam, I do think you have an injury to one of the muscles of your rotator cuff. That's a group of muscles that help control your shoulder joint. The local clinic that I mentioned earlier should be able to help you with that injury as well.
Okay.
Do you have any questions about that, Alma?
No.
Okay, well, just let me know if you do. Do you have any other scars or injuries from this attack?
I don't think so.
What about any scars or injuries that aren't from this attack, maybe from childhood?
I don't remember.
Okay. Well, if it's all right with you, I'd like to do a skin exam just to make sure there aren't any other scars. We'll start at your head and work our way down to your toes. We'll use a drape to help keep you covered during the exam. Now, I won't examine your breasts or your genital area unless there is something specific that you want me to take a look at. Does that sound okay to you?
Okay.
Okay, great. So the first thing I'd like to look at is the front of your chest. Could you pull the gown down just a little bit so I could see that area? Great. And everything looks normal. You can lift that back up. Was there anything on your breasts you wanted me to look at today?
No.
Okay. Next, we're going to take a look at your arms. So if you could put your left arm out like that and pull that sleeve up for me. Great. And then flip your arm over. Okay, and same thing with your right arm, out like that, and pull that sleeve up. And flip it. Great, thank you so much. Everything looks normal there. So next, I'd like to take a look at the skin on your back. Would it be all right if I stand a little bit behind you so I can see that area?
Okay.
Okay. I'm just going to open up your gown and take a look at the skin on your back. And again, I don't see anything there. Did you want me to take a look at your butt for any reason?
No.
Okay. Would you like me to help close up your gown for you?
I can do it.
Okay, great. I'd like to take a look at your stomach now. We'll use a drape to help keep you covered during the exam. Is that okay?
Okay.
Right. Okay, Alma, if you could lift your gown up just so I can see your stomach area, and we'll keep you covered with this. Okay, and everything looks normal. Go ahead and lower your gown. Great. And next, Alma, we're going to take a look at the skin on your legs. We can start with you sitting, if that's all right.
Okay.
Could you raise your gown up just a little bit so I can see the tops of your legs? Okay, great. And could you turn your left leg a bit so I can see the inside? And same thing, turn your right leg. Great, thank you. You can lower your gown now. I'm going to take a look at your lower legs. I notice you have a little scar here. What's that from?
I got it from falling off a bike when I was younger.
Okay. Would it be all right with you if I take a picture of that scar as well?
Okay.
Okay. Right. And is it okay to use that picture?
Yes.
Okay, great. And would you mind lifting your feet so I can see the bottom? Okay, great. And those look normal. Okay, the last thing I want to do is take a look at the backs of your legs. I'll need you to stand up for that, and I'll have you pull up the back of your gown just a little bit so I can see the backs of your thighs. Is that okay?
Okay.
Okay, great. If you could stand. And go ahead and lift your gown up just a little bit for me. Okay, great. And everything looks normal there. You can go ahead and take a seat again if you like. When I spoke with your lawyer, she didn't think you'd need a genital exam today, and often when someone experiences sexual violence a while ago, we actually don't find anything abnormal to report. Would you like me to perform a genital exam today, or we can schedule one for a later time?
No, I don't think we need one.
Okay. If you change your mind, just let me or your lawyer know. All right, we're all done with your physical exam. I'll step out of the room so you can change back into your clothes, and then I'll come back so we can finish talking.
Okay.
Is it okay for me to come back in, Alma?
Yes, I'm ready.
Okay, Alma, I have one last question for you before we wrap up. If you are able to stay in the U.S., what dreams or hopes do you have for the future?
I thought I might like to be a doctor. I was really good at science when I was in school, and I'd like to be able to help people who are in pain.
That's a wonderful goal to have. Thank you for sharing that with me. I think that's all the questions I have for you. Do you have anything else you'd like to share or any other questions for me?
No, I don't think so.
Well, I want to thank you for sharing your story with me, Alma. Sometimes telling your story can help. Sometimes it can be exhausting, and it might even bring up things you don't really want to think about. You might feel better when you get home, or you might feel worse. I want you to know that either feeling is normal. Do you have someone you can talk to later if you need to?
Yes, I have an appointment with my counselor tomorrow.
That's great. Well, now that our evaluation is over, how are you thinking about spending the rest of your day?
My Thea's picking me up, and we might go get something to eat. There's a really good pupuseria on the way home.
That's great. I'm glad you can spend some time with her and get some nourishment. Let me share with you the next steps on my end. Over the next few weeks, I will review all the notes and the photos that I took, and I will write a report with my findings. Once the report is ready, I'll submit it to your lawyer. When you see the judge, that document can then be part of your immigration application. Your lawyer can reach me at any time, so if you have any questions or anything else you'd like to tell me, just let them know.
Okay, I will.
And I will be sure to give your lawyer that information about the local clinic so you can access the health services that we discussed.
Okay, thank you for doing that.
It was wonderful to meet you. I'll walk you out.